Welcome to Neurotalk, May 31st, 2025. The case I'm presenting today is on neurocysticercosis. Trigger warning, we will be talking about parasites. I'll be showing some brain images and talking about a hospital. So if any of those trigger you, this is not the presentation for you. Okay, what is this thing? What is cysticercosis? What's happening? First, we have a tapeworm. It lays eggs. These eggs hatch, and that is what becomes these cysticercus for singular. Well, how do we get them? Well, first, let's talk about these eggs that come from the tapeworm. They usually are in feces passed into the environment. Pigs, swine, they ingest these eggs, which then hatch, penetrate the intestinal wall, and circulate through the muscle. Humans acquire this tapeworm infection by consuming that infected meat or by not washing their hands and then touching their mouths. Once it's in the human host, same thing as in the swine, those oncospheres hatch, the eggs hatch, they penetrate the wall, they circulate to the musculature. But for us, they develop in any organ, most commonly in the subcutaneous tissues, which are under the skin, in your brain, and in the eyes. So this is cysticercosis, is the condition of all of these cysticerci. Neuro is in the brain, in the nervous system. So that's what we're talking about today. Our case, 18-year-old male, past medical history, none. He presented to the emergency department 4 different times for severe headache. They couldn't find anything wrong with him at all. I think they even did a CT at one time with no findings. Then he started to have seizures that 4th time. They did an MRI and it showed neurocysticercosis, over 200 cysticerci. Wild. Come to find out, he went hog hunting with his brother. They butchered the hog. He specifically killed the hog, butchered it, kind of washed his hands, splashed his hands in the creek, cooked the meat, and ate it without soap, water, all of that. And that is how he ingested all of those eggs. He also had hydrocephalus, which we'll talk about in a little bit. Hydro, water, cephalus, brain. And his goal, he just wanted to graduate. That was his main goal, is to be able to graduate. This is not his brain scan, but it's very similar. As you can see, there's all of these eggs, cysticerci, cysts. Probably a variety of different development. You can see here too, his ventricles are a little swollen. The brainstem seems to not be affected. And this was pretty true for him as well. He didn't have a lot of cysts in the brainstem area or in the cerebellum. Hydrocephalus, this is what your normal ventricular system looks like versus filled with water or filled with cerebrospinal fluid, hydrocephalus, and it causes a lot of swelling in the brain. There's a lot of fluid here. The body is trying to repair itself. You have all these infectious materials that it's trying to get rid of. Prevalence, the number of people with cysticercosis, where in the world does this happen? Number 1 place is Mexico. I think they have the most. Followed by Peru. Actually, whoa, this one is big, Guinea. And some places in Africa, there's quite a few prevalence occurrences there. Good job, Canada, Europe, and Australia. 0 there. Excellent. Symptoms. Only 20% of the people have symptoms. 70% have seizures. The most common symptom is headaches and then hydrocephalus. This condition mimics pituitary tumors. A lot of times it is misdiagnosed, or it takes a while for them to fully diagnose this condition. For example, maybe if they have 1 or 2 eggs, maybe 3. It might be hard to see. How do they diagnose this? Well, CT, MRI. You can do a CSF fluid test, a lumbar puncture where you're testing the fluid. However, it's really more for confirmation. There's no guarantee eggs are going to be in that fluid. Stool samples, same type of thing. By the time it gets to the brain, it's already past the intestines a lot of times, and it's not very accurate. Really, the best accurate way to diagnose it is through imaging. Well, what about treatment? What does one do if they ingest all of these eggies? Well, antiparasitic medications, anti-parasite, right? Corticosteroids to help reduce swelling, inflammation in the brain, anticonvulsants, that's anti-seizure medication, and diuretics to try to get all of that fluid out, try to get all of it out, especially hydrocephalus. For surgical interventions, they could drain the CSF to reduce the pressure. They can try to remove the cyst if possible. In our guy's case, he had so many of them, there's no way you would be able to remove them all and still have a functioning brain. So it was better for him to just keep them there, give them the medications, and see what happens. Sometimes they can go to the spine. The eggs can travel that direction, and they can decompress the spine and take them out occasionally. Rehab, this is me, right? OT, PT, speech, very long term. We see them for usually a good year. After this, it takes a long time to help your brain recover. That's a lot of eggs. If you want to see more cases, I put a QR code here if you want to see some more brain scans. I think it's really interesting. I think this one is really interesting, mostly because you can see this gigantic sac here, cyst here. It looks like maybe the worm kind of exited here. Here are your sister C. You can see the worm inside their cyst, and same there. Let's review the arteries here a little bit, because this is one way the eggs get in. They get in through the venous system as well, but primarily through the arteries. This is what the vascular system of the brain looks like. This is just taken out all the brain tissue. This is what you're left with. There's 3 arteries that I want to talk about here that supply the brain. You have your anterior cerebellar artery, which goes to your frontal part of the brain, the anterior part. Your middle cerebral artery, that's this here, it supplies this whole region. And the posterior cerebral artery, going more towards the back occipital lobe and such. Your big daddy artery, your basal artery, I call it big daddy. These are supplying your brainstem. And for him, he didn't have anything in his brainstem, which was really great. Here you can see how it could go, kind of to the spine. It does go that direction, but normally it comes through here into the basal artery, these eggs, and they kind of travel this way and are distributed throughout. Okay, if you look at the homunculus and just different areas of the brain that are supplied by that artery, it might make a little bit more sense the next couple of slides. The anterior cerebral artery, sensory, motor, but also memory, executive function, and personality, because it is supplying your frontal lobe. If the wormies traveled through the middle cerebral artery, sensory homunculus, you got tongue, pharynx, upper lip, nose, face, neck, head, a lot more upper body. On the motor homunculus, same thing, more upper body, swallowing, jaw, tongue, lips. Your lower body tends to be more anterior cerebral artery. on the green area, again, middle cerebral artery, controls language, attention, and memory as well, because you have that parietal side. The posterior cerebral artery is supplying the occipital lobe, vision, perception. For him, the majority of his ailments or deficits, where the egg settled, the cysts, were in the middle cerebral artery. So this is where he had the most difficulty. Language, attention, memory, in this area. So let's look at his systems. What all was going on here? For vision, he had some visual field cuts. He wasn't able to see in different parts of his vision. Depth perception, knowing what's far away versus what's close together. And figure ground. Figure ground is looking at 2D objects and determining, basically, if you're looking at shadows, what's coming 3D, what's 2D, again, far away type of things. This is very simplified. Cognition, he had difficulty with short-term memory. Working memory, asterisk star. This was his number one challenge, was that working memory. And again, his goal is to be able to graduate so he can go to college and be with his friends and peers. And this was his biggest challenge and his biggest deficit. He had some problem-solving issues, a lot of attention. He could only pay attention maybe a minute or two. Constantly, we had to redirect him. This is what we're doing. This is what's happening. And for his motor, he had hemiparesis. So what that means, hemi is half, paresis, weakness. So half of his body was weak. I believe it was his left side. He did have some balance and coordination issues, but I think it was more related to his vision. He didn't have a lot of cysts in his cerebellum at all. And he had quite significant visual cuts, and that depth perception, knowing what's far away, what's close together, that can give you some balance issues. Swallowing was another big deficit for him, big challenge that he had to overcome. Speaking of vision, let me show you a little bit about the visual system. Each eye has its own left and right field, right? It has its own separate field, and then, that way they can overlap a little bit, and you get your whole field of vision. So if let's follow the left eye. The left visual field of the left eye comes from the right side of the eye. This is your optic nerve. It crosses into an optic chiasm. As you can see, each eye has its own, right? Once it crosses the chiasm, they travel to the same part of the brain. This is the optic tract, and then they radiate to the occipital lobe. If you have a lesion here, that would be your entire right eye would have some blindness or be decreased because it's both visual fields of the same eye. If you have a lesion at the chiasm, you get temporal loss or peripheral loss. This is pituitary mass here. And because that's where your pituitary gland is very close to there. And you'll only see you only have nasal vision. You will lose a lot of your peripheral vision. He had a lesion right here at number 5. This makes sense. This is kind of the area of the brain that he was having a hard time with, that middle cerebral distribution. And what happens there is you get homonymous hemianopia. So homonymous, same side, hemi, half, anopia, vision. So half, or opia, I guess, is half of your vision. So what happens is, if you follow the red, okay, this one, you can do an X there. It doesn't have the left field of vision. Okay, if you come this way to the other eye, same thing. He lacks half of his vision there. And you can see in this part of the diagram, the black part, he lost his vision on the left visual field of both eyes. So when I was talking about balance and coordination, this was really hard for him. He had a big pieces missing from his visual field, and he wasn't able to tell what was far away, what was close, the sharp lines of different objects. So this really affected him. And again, he wants to graduate. So to be able to graduate and go to college, you have to be able to read. You have to be able to understand what's happening. This was definitely a big challenge for him. Sensory, surprisingly, was intact. He didn't have a lot of stuff going on. And behavioral, a lot of personality changes according to his family. I didn't know him before, but according to his family, he did have some personality changes. He used to be just very easygoing, no problem. Now he's irritable, very impulsive, apathy, not really caring about a lot of different things that he used to care about. And then his cranial nerves are mostly intact. Remember I talked about big daddy basilar arteries, big daddy artery in your brain wasn't really affected. He didn't have any damage there, which was really good. Okay, rehab course, acute care. That's where I saw him at the hospital for about a month. We saw him total all 3 disciplines, hour and a half hours per day. That's all he could really tolerate. We had multiple setbacks because what happens is with the antiparasitic medication, it doesn't kill the egg. The egg has to hatch first for it to work. It has to hatch and target the sister seed. I think there is a new medication that does target the eggs, but at that time, we had to just wait for them to hatch. They were all in different stages of development, so every day was a new day. One day, he didn't have left-sided weakness. The next day, he did. One day, he could see fine. The next day, half of his vision was missing, which made it very, very challenging. And it took about 4 weeks for all of the antiparasitics to work and for all of the cysts to die. From then on, he went to inpatient rehab. So it's 3 hours a day, 5 to 7 days a week. It's pretty intense. I mean, that's half of your waking hour right there when you're recovering from any kind of brain injury. Your brain is tired. And the things that we worked on in inpatient rehab, a lot of reading, different types of reading. Do we do, should we treat him more compensatory? Meaning, if somebody is blind, we might teach them how to use some adaptive equipment. Do we do that? We really want him to be able to see and work on his vision. So we did a little bit of both. Handwriting, being able to write, because he was left-handed, of course, and it was his left side that was affected. Being able to get up, move, do things for himself. These were all really important for him. And finally, he went to outpatient rehab, which was 3 times a week, 3 hours a day. So a little bit less intense. And he was in outpatient rehab, I want to say 1.5 years. Like I said earlier, it takes a long time to recover from these things. And it took him a good 1.5 years, but he finally was able to get receive his graduate education degree. He wasn't able to graduate high school, but he was able to do a certificate. And then he went on to community college, which I think he might have graduated. I'm trying to remember, but basically he took 1 or 2 classes at a time. And that working memory, like I said earlier, that was really the hardest part for him. Residual deficits, that homonymous hemianopia that we talked about, but it was mild. It wasn't too bad. We were able to make some gains. Still a little impulsive, lacks some insight and problem solving into different situations, especially social situations. Slight left-sided weakness, but it was enough for him to be able to type. And he had accommodations where he typed all of his assignments. He didn't do any handwriting, anything like that. And working memory. Overall, it was success story. He survived. He was able to recover to the point where he could go to college and learn a skill. So overall, I think it turned out well. Thank you for listening. I appreciate it. If you have any questions, feel free to DM me on the server. And here are my references.